Hi, everybody, and welcome to our second podcast for Vantage Hospice. Today, I have with us Miss Bridget Wilson, who is one of our patient care managers here at Vantage, and I'll just give her a moment to tell you a little bit about herself.
Well, hello, I'm Bridget, as Nicole said. I've been at hospice since about 2005, and I've probably done every job that hospice has to offer. I've been a triage nurse, I've been an on-call nurse, I've been a case manager, a director of clinical services. I've even been on Nicole. So I've prayed with people, I've counseled people, I've bathed a few people. So if you pick a job in hospice, I've probably done them all.
So today, Bridget, we just wanted to talk because one of the reasons that we want to do these podcasts is education, right? So we're trying to educate the public at large about what hospice is and kind of what to expect when you come on hospice. And there are so many hospices in the Houston area. I mean, we like to hope that everyone is doing the right thing, but I mean, as you and I well know, sometimes they don't. And I just wanted to just put it out there. Like when you're looking for a hospice company, what should you look for? How do you know if they're doing a good job? And like what services and stuff should you be expecting? So that's kind of where we were going to start. So what are your thoughts about hospice and like, why did you choose hospice or did hospice choose you?
I think hospice chose me, even when I was an ICU nurse at Herman Hospital before it was a Memorial Herman. When the patients were dying or close, nobody wanted to take care of them. So everybody gave them to me. So I think hospice kind of found me and then kind of called me out. So it kind of became my second niche. I was an ICU nurse for more than 14 years and then left there and started doing hospice.
You're not old enough to have all those careers, by the way,
Oh,
at all, at all. So mm, pretty much the basic things about hospice that everybody kind of needs to know is that the benefit itself is pretty much standard. There's not a lot of leeway and wiggle room in what CMS and the government has said. This is what a hospice must do to become accredited, to remain accredited, and to be compliant with everything that they're doing. So the basic things are you have to have a core team of people. You have to have a nurse who is a case manager. You have to have a physician. You have to have a social worker. You have to have a chaplain. You have to have an aide. So those core group of people come together to create an individualized plan of care. And that really is one of the differentiating factors for hospice in general is that interdisciplinary team and that interdisciplinary and patient specific plan of care. So individualized plans of care. The other thing that you should expect as from a hospice, I think, is the three levels of care. So do you want to talk about those levels?
so there are three levels of care. One is routine home care, which is generally where most people start and end. And as the need arises, then we have the option for a respite care, for caregiver strain or relief. Sometimes it's maybe you've been taking care of your loved one for a very long time and there's a wedding coming up and you just want that weekend
Hmm.
off. So we certainly can offer respite level of care for those 5 days that are
So
approved.
is there a limit to the number of respite times you can be on?
There is no limit.
So what are the regulatory guidelines related to respite and how does that work?
It must be in a skilled facility.
Okay.
So you can't do it at a personal care home. You can't do it at someone else's home. Sometimes that people say, well, my cousin can keep my mother.
Right.
Well, that's not going to be a respite level of care. That may just, you're moving to a different service address
Good point. Good
and we'll
point.
follow you there, but it will not be a respite level of care. We won't pay them to take care of your loved one.
Got it.
But so for care, it's caregiver relief in a skilled facility where there is always a nurse available. Medications are available. And then there is general inpatient or what people like to call as crisis care. When you have an unmanageable symptom that can't be managed at home by a non-clinical person and you move them to a different level of care.
Okay.
So we ought to offer all three.
Absolutely, which we do,
We
obviously.
do.
Um, let's go back and talk a little bit maybe about the routine level of care, because since that's where most people are going to spend the majority of their time. And again, hospice is a lot of times it's a philosophy of care. It's not necessarily the hospice staff sitting at the bedside taking care of your loved one 24/7. But we teach you, we educate you, we support you on during these transitions and processes to make sure you know what to expect and what's going to be coming up and how to manage those things as we move through it. So the routine level of care, I mean, there's a lot of things that are included in that routine level of care that a lot of people may not know. So what's in that routine level of care?
There is everything in that routine level of care with the exception of one-on-one crisis intervention care and caregiver relief. When the aide, the nurse, the chaplain, the social worker come, they should meet your needs at every visit.
So, what other type of things are covered with that? So, supplies, maybe?
Supplies, medication, durable medical equipment. And just to explain that, it's oxygen, a bed, suction if necessary. Those are pretty standard things that we order for most of our patients on it.
So, when we talk about medications, because that's always a hot topic,
Yes, it
right?
is. Yeah.
So, we discuss a lot of times people get terrified when they come on hospice. They are very scared that we're just going to just take everything away.
Everything, right.
And I was an admission nurse for a very long time. And one of the things that I always said is hospice should never remove or withhold something that is beneficial to your loved one. So that's where the conversation should start when you're talking about medications. The regulatory guidelines are very, very clear on what should be covered when it comes to medications and really just about anything.
Mhm.
So it covers and encompasses not only the diagnosis that you're on hospice for, right? But also anything that is related to that diagnosis
Correct.
or that the hospice deems is appropriate.
Correct.
So one of the things that is interesting in philosophy here at Vantage is the body is all interconnected.
Correct.
So there is very little equipment or medications or supplies that we would not cover. Now, just as a little caveat about that, there will be a discussion if something is not beneficial to your loved one, which may be a difficult conversation to have if, and I'll use this as an example with dementia.
Yeah.
So if you have a dementia patient that is on hospice and they're continuing to decline and they're still taking their Aricept or their Namenda,
Okay.
that may not be something that we would want to continue because they're still declining as
Right.
you are,
Despite the medication.
in spite of everything that we're trying to do with the medication. And we all know that there's pill burdens, especially as you're moving through the disease process and the dying process.
Side effects.
Side effects. Exactly. You want to talk about those because they
So a
can make
lot
you
of
feel bad.
times, some of your side effects of medications, you can get a lot of nausea, you get a lot of dizziness. And so when they're trying to get up and get out of bed, it becomes a safety hazard from a medication that they've taken forever, but now it's causing more problems than it's worth. And so there are times when it is very appropriate to change and lighten the pill burden.
Exactly.
Because if we're in stage dementia, then we're at that last level.
So, we're talking about being end stage and being way past medication. I just don't want people to think that like we come in and we're just taking everything away. It's a very conscious.
Past the efficacy of the medication.
Exactly.
They just aren't working like you would have anticipated in the beginning.
Right. And then essentially, I think another thing is the risk outweighs the benefit.
Correct.
Right. So those are the conversations that you should expect a nurse to come in and have those conversations with you to talk about those type of things. And again, I know it can be scary, but it really is knowledge is power. So the more you know, and again, you're in control as the caregiver, as the patient, even you're in control. So just because we recommend that you stop something doesn't necessarily mean that you have to, but there are financial
Correct.
burdens and regulatory guidelines that have to come into play if the hospice has determined that this medication is not effective. The other thing that we want to talk about is just as a routine level of care goes, we all have regulatory guidelines. Every hospice that you
Right.
come into contact with has a regulatory guideline, right? We have a minimum of an RN has to physically see you and do a whole head to toe comprehensive
Every
assessment.
14 days.
Right. So what does Vantage do?
While at Vantage, we don't wait every 14 days. We see our patients weekly as
Awesome.
needed.
So what about the aid? Because I know one of the interesting things when I was speaking with people, when we first brought people on, everybody was terrified about having somebody come in and give them a bath.
Right.
It scares people to have people come in and
Stranger.
a stranger and see them in their most vulnerable form. So what do we do at Vantage to kind of ease that burden or?
I think with anything, there has to be a level of dialogue and communication. So it starts with the admitting nurse explaining what the levels are, explaining who are the members of the team. Then when they meet their case manager or their primary nurse, then there's even more conversation and discussion. Sometimes it's even appropriate to send the aide the first time with the nurse to make this formal
Very true.
introduction. And once it's done, maybe we start off with one visit a week and see how it goes. And we can increase as the patient's needs are required.
So what if don't want you to give me a bath? Are there other things that the aide could be doing besides just giving me a bath?
Absolutely. There's a level of companionship that goes with caregiving, a level of making sure the linen is changed on the bed, making sure that there's water available for a patient who may be not quite bedbound, but just difficult to get back and forth from the kitchen to the bedroom. So there are lots of things that I like to see. And companionship with people who are in facilities is one of the biggest ones.
Oh, I think that's
Because
so
as family, we should be visiting our loved ones, but we all know we have jobs, we have other responsibilities, we
exactly.
can't be there all the time. But if an aide could come 30 minutes, even if I refused my bath and just sat and read to me or held my hand, it might make my day the best day ever.
And Vantage Hospice, definitely our aides are top notch. I mean, some of the best in the business. And they are all trained
Yes.
from the very beginning that I call it fluffing and puffing, which means you're fluffing people up and you're making
Correct.
sure that they just feel great. I mean, we all know the benefits of, I mean, if you've ever been sick in a hospital for very long
Right.
and not been able to get a bath or to get in water, the act of just getting in the water is sometimes, I mean, just can make you feel 100
Correct.
times better. What other types of things do the aides do? Because I know I've seen things come across my desk for scented soaps and
Right.
nail
We
polish.
have really great aides who sometimes want to polish Miss Jones' nails because she always had them polished when she
Right.
was up and about, but she can't get to the nail salon anymore. So our aides will polish nails. They don't necessarily like that non-scented generic soap.
Very
So
true.
they spend a lot of their own money sometimes buying and providing those things for those patients that they've kind of taken an extra interest in. There are always some patients that just get near and dear to your heart pretty quickly,
Absolutely.
and some that you take care of because it's the right thing to do. But others, there's just something that reminds you of your grandmother, your mom, and you kind of fall in love with those patients, and your care reflects that love.
Right. Agreed. Moving on to the social workers. I mean, I think the word social worker scares a lot of patients, especially home patients and
Yeah.
families who feel like, I
You're
mean,
going to get in my
they're going to
business.
get in my business.
Yeah.
So, what is the role of the social worker? What should you expect from a social work visit?
So social workers play lots of roles. There are times when there are family dynamics that need to be addressed.
Hmm.
Sometimes they're financial things. Maybe you've been taking care of mom, but you don't have a power of attorney. Maybe nobody ever considered that. What are we going to do to have access to mom's things as she no longer can? So the social work kind of provides the insight into that. Caregivers, when it comes time for private caregivers, because let's say your mom lives with you and you're going to work every day.
Right.
She can't stay alone all day long, but maybe somebody needs to check on her a couple hours every day. So the social worker can provide resources for helping you find private caregivers that you can pay to come and visit. So I think it's not just about getting in your business, as
Right.
we all like to think. Because as a nurse, first thing I say when I need social work, I'm a nurse. I don't need a social worker.
I don't need to,
I don't
I'm
need a
good. I
social
got that
worker.
covered.
Right. But from a job perspective, absolutely, I think they have a role and a place.
They also provide some counseling services
Yes.
too, right? And
Yeah.
preparing you for the
Yeah.
inevitable,
What's to
right?
come?
What's to come. And just getting you ready and being able to help kind of sort through, as Bridget said, family dynamics at this time. I mean, it's difficult. It's a very difficult thing. And I mean, I used to tell people all the time when I was one on one with patients and families that death and dying and crisis does not bring out the best in people a lot of times. So people are not on their best behavior, and being able to have someone facilitate and
That neutral
mediate
party.
that, yeah, that neutral party to get them to be able to communicate a little bit better and just be free to express themselves. So that brings us to our chaplains who are phenomenal. I love our chaplains so much. So what would you expect in a chaplain visit? Because I know that there are, I mean, there's many denominations and
Right.
beliefs out there.
So we're not looking to convert anybody to any particular religion, but sometimes people have needs that appear to be medical when more they're spiritual.
Right.
Sometimes you just think you need forgiveness from something. They can't impart the forgiveness. They could be that in between where maybe you just need to say it and get it out to someone who's not going to judge you,
Right.
who won't tell anybody. And it allows you to have some peace with that. They also provide some counseling, some pre grief counseling.
True.
Sometimes when there's a family where there are young children involved, if we know early enough, then we can get involved. And so that the bereavement process is not as belabored. We can start early helping families cope and adjust.
So they're not going to come and sit and
They're
hold
not
my hand and pray with me if I don't
gonna
want to
put a
pray.
cross on
I'll
your
put a cross on
forehead.
my forehead or anything like that. Again, these are just real people who have been called to really support.
To minister help.
Yes.
It's a minister
So
help.
it's not necessarily, I mean, I mean, honestly, our chaplains are all very well versed in meeting a patient where they're at and providing what they need.
They all have a sense of humor.
Yes, they do.
That
Oh my
sometimes is
Lord, they
needed
do.
in a family.
Oh yeah, absolutely they do. But I remember Rick, for example, one of our chaplains, like he doesn't bring the Bible in that first visit unless somebody is specifically requesting that. It really is a supportive.
Rick is more the storyteller. He gets you
He
to tell your
is.
story.
Absolutely.
And I think it's cathartic when you can tell your story.
Absolutely.
And so I think the chaplains play that large role in allowing people to help tell their story.
Yeah, that life review. I mean, I think life review is probably one of the most important things I think that we do in hospice.
Yeah.
I mean, during the 20 plus years that I've been in hospice, the number of stories that I've heard and just the amazing people I've met. And then you look at someone who is lying in the bed who may be nonverbal or is past the point of being able to really communicate. And then to hear of all these amazing things they did during their life. And we help facilitate hospice in general, helps facilitate the family in writing those things down and making sure there's a record if that's something that you guys would like to do. So it really is a supportive environment. And again, like Bridget said, just coming back to the beginning, good hospice should be there to meet your needs, whatever those needs may be.
Right.
So you should never feel alone. You should never feel like, I don't know the next steps. I don't know where I'm going. I don't know what to be doing. So, I mean, we strive to make sure that everybody is communicating and making sure that you know what those things are. So,
Right.
what do you think is the most important thing that Vantage Hospice offers to the community?
Communication. I think we do a great job of communicating with our patients and families. I'm a firm believer that you're already waiting to die because you have a terminal diagnosis and you shouldn't be waiting on me to decide that maybe I'm going to come today at 10 or 3.
Right. Very true.
Give me an idea. Allow me to live until I die and not wait on you.
Let's talk about what to expect from a hospice in general. So, how would you know that you're with a good company? What would you look for?
I think they have to be responsive to your needs. Now, Houston is a large city. We're not going to be there in 5 minutes, but if within 5 or 10 minutes, you should have someone on the phone for sure.
Agreed.
So we should be responsive. I think we should consider not only what we deem as best, but take into consideration what you feel that your loved one needs. It can't just be our decision.
Right.
It's a group effort. It takes all of us to take care of this patient and this family. It's not just about the patient. It's about everybody attached to that patient.
That's true. That's very true.
So if your hospice is not responsive, then maybe it's time to look someplace else. I know getting back to just a visit, some hospices, the regulation says every 14 days. But a lot can happen in 14
Oh,
days
yeah.
if we're not coming. And yet I know some hospices, they only visit once every 14 days.
Wow.
But that's not who we are. So if you can't get the responsiveness from your agency, then maybe you have to have a conversation. And I'm not saying jump ship and leave the hospice you're with, but absolutely have dialogue.
Right.
Talk about what's needed for your patient and family. There are some families we have on service now who only want visits once every 14 days.
Right. True.
Because it's a patient with cancer who's still working half time,
Sure.
hasn't quite decided to give up going to work. And yet we check on them, but we don't have to go every 14 days.
Right.
But as they decline, we ought to be there to meet that weekly need. And sometimes more than once a week if symptoms
Absolutely.
arise, so that we are responsive on every level.
So, I mean, that kind of leads into a after hours on call discussion as well, because that's always a hot topic too.
Yeah.
And one of the things that I'm very proud of at Vantage is we have a fully staffed after hours
Correct.
team. It's not just one person running all over
Right.
all over Houston and surrounding areas
And the weekend.
and the weekends. Yeah, we've got what, 6 now,
6 on the
6
weekend.
on the weekends and 3 on the weekdays, which
And a backup.
and a backup. True.
And backup on the
and
weekend.
backup on, yeah. I mean, there's backup everywhere. But one of the things is, I mean, really, I mean, our commitment has always been that someone will be to you within an hour
Right.
if you call after hours. So if it's an emergency, but that hour can be scary. I mean, if you're in a situation where maybe a patient's having difficulty breathing, or you're in a situation that you're really unsure of, our commitment is that we're on the phone with you. Someone will be on the phone with you
Right.
to keep
A
you calm,
licensed
a
person
licensed person, a
is on the
nurse.
phone.
We have administrators on call that also are available to help support. We have physicians that are on call that are available 24/7 as well. So, I mean, our commitment is we take care of you all the
There's
time.
even a social worker,
Social worker and
chaplain
chaplain.
that they call as
Absolutely.
well after hours.
Absolutely. Absolutely. I guess leading into supplies, we always talk about medical supplies, and there's always these
What's enough?
what's enough, right? Or what's too much. So we do have a standard of care that we provide with incontinence supplies. And I mean, there is a limit to what can be
Right.
distributed. But again, we are patient specific. So if there's something going on that you need an increase, I mean, again, like we talked about in our first podcast, all the decisions are made right here.
Right.
So if there's something that you need or some issues or problems, everything is decided
Communicate,
down the hall,
understand.
right?
Yeah.
Let us know. So it's our job to make it easy for you. That's our job.
Right.
And we take it very seriously. So one of the other things that is unique, and actually there's a couple of things that are unique about hospice. The first is that the government actually supports a program
Mhm.
that has a chaplain in the core group of people. But when they were creating the benefit, they found it extremely important that the spiritual aspect of a person's life be addressed, right? And that spiritual aspect, as Bridget hinted to, it can cause physical pain. It can cause
Correct.
physical discomfort. It can cause, I mean, there's a lot of things that can happen if you are not settled. So that's one thing. But in the same vein of that, with down that line with the bereavement, I mean, with the chaplains, we have a bereavement program, and it's a requirement for all hospices to have a bereavement program. We have to follow, I say have to, it's our privilege to actually do that, to follow families for 13 months after the
Most
patient
definitely.
dies. So do you want to talk about our bereavement program?
So for 13 months, we're actually following up with calls, with cards, with letters, and we follow up on 13 months past the death. So even at that 1 year anniversary, you're still hearing from us. We're still concerned about your well-being. I've known our bereavement coordinators actually make visits to families
Yeah, he has.
during that period. Some people in the beginning don't want bereavement. They think they don't need it.
Mhm.
Then all of a sudden, 6 months later, there's this meltdown
Right.
and you don't know who to talk to. It's a great time to call hospice again and say, hey, I didn't think I needed that, but is it okay now? And we'd be right there.
Absolutely.
And
Absolutely.
if it's complicated grief where you're not eating, you can't go to work, then we absolutely can make appropriate referrals for
That's a good
complicated
point.
grief.
That's a good point. What type of referrals do you think? I mean, do you make, I mean, I guess counselors and
Counselors, so for
therapists?
children, there's Bo's Place. We
Oh,
give
very,
referrals to
very true.
Bo's Place for children who've lost parents.
Absolutely. So, in conclusion, the hospice company that you pick is very important. You want to just make sure that whoever you're choosing is there to support you and is there to meet your needs and is there to listen and be involved and have you involved in the decision making process for you and your loved one.
Right.
So, I think that's probably, if anything, to take away from this podcast is communicate, ask questions. And if someone is not meeting your needs, it's okay to say that. It's okay to bring that up. And Vantage is always here to help and support in any way that we can. If you have a question about something, I mean, even if you're not on our service, you're more than welcome to give us a call and we can definitely talk you through
Right.
how to figure things out. So that's our commitment to Houston. All right. Thank you so much for joining us today. See you next time.